we have a process for making these decisions, and that it's a multidisciplinary approach, and that it's not a decision I'm making in isolation. So it's very useful from that standpoint to be able to tell a family about that, to allay some of their concerns. We all want to make the best decision so that our patients are at the least amount of risk, and that we don't make decisions that inadvertently affect other patients. So for example, if I schedule a procedure that I think is probably going to be able to go, a patient who will be able to go home in 2 days after a brief period of time in the hospital, but I haven't managed to think through the risks sufficiently as far as, will they need an ICU bed or not? What is the risk of blood transfusion for that patient? And I haven't had to quantify that preoperatively. Then I might make a decision that could reduce the opportunity for us to provide that bed to another patient, or may place some further constraints on our blood supply. So with respect to the blood bank, we know that's an important consideration. We've seen the impact of constrained blood supply affect patients. And that's not just the pediatric patients, but our blood bank obviously is a blood bank that is relied upon for our adult patients and as a community as a whole. So these decisions are not made in isolation as a single surgeon. And I think that's one of the great strengths of this.